Bloomberg Audio Studios. Podcasts, radio, news.
You're listening to Bloomberg Businessweek with Carol Massar and Tim Stenovec on Bloomberg Radio.
Well, the drumbeat of news out when it comes to health policy in the U.S. continues. House Republicans are taking a middle-of-the-road approach to funding the federal health department by making deeper cuts than their Senate counterparts, but granting only some of President Trump's wishes. Also, the Trump administration tapping a deputy of HHS Secretary Robert F. Kennedy Jr. as the acting director of the Centers for Disease Control and Prevention after moving to oust the agency's current head in a clash over vaccine policy. Quang Pham is back with us. Quang is founder, chairman, and CEO of the microcap biopharmaceutical company, Cadrenal Therapeutics. It trades under the ticker CVKD. It's got a market cap of around $25 million. Shares down about 13% so far this year. Quang, good to have you back. Joins us from Florida once again. I wanted to start by getting an understanding of the relationship that your company has with Washington, D.C. Obviously, it's a small company, so it's not like you necessarily have lobbyists on the ground in Washington, or do you, to get an understanding and actually lobby what's happening in Washington? Are you able to have lobbyists?
Well, Carol and Tim, nice to be with you again. And you are correct. We're a small company. We don't have lobbyists on the ground in Washington, D.C., but we in Florida are very proud that we have a number of Floridians in the Washington area, as part of the administration. But as far as what is being talked around the Beltway, it doesn't really affect us. We're a small public company, late-stage drug development company, focusing on developing a new blood thinner. I think what it does affect is the reduction in the NIH funding, the National Institute of Health, for preclinical stage companies that are very early that are depending upon government grants, and mostly at research, the top research universities that feed into the biotech ecosystem. It'll affect those early stage preclinical research. And just to give you a summary, I think, the FDA approves last year about 45 new drugs, the year before about 37. And these are drugs that are approved out of about 200,000 compounds that entered the preclinical stage of research over a period of 10 or 15 years ago. So we're talking about a very highly capital intensive and long drawn out research development process for drugs.
What do you think of Secretary Kennedy and potentially the impact healthcare and all the companies that certainly play into that space, including a company like yourself?
Well, first of all, I respect the political process. This country elected a president, and he appoints individuals in important posts. As far as we are concerned, FDA level staffing is what affects us in many drug development companies. And that means the amount of time in the regulations that the FDA is required to respond to companies like Cadrenal Therapeutics that puts in for different programs, different drug designations. For example, we have 2 orphan drug designations for our lead candidate, tecarfarin. And every time we need to communicate with the FDA, there are a certain amount of days, business days. So when there's a reduction in staff in the FDA, that delays our timeline, which then delays the development timeline, which then takes more capital. And then we need to communicate that to our investors and our shareholders. And that affects not just us, but the entire industry.
Are you seeing more delays in this administration versus last? I mean, give us a little context, if you will.
I think going into January, just the transition of the heads of the FDA and different departments. And the FDA did communicate to us that there would be a little bit of a delay. But so far, the delays have been minimal.
Carol asked about comparing to the previous administration. I want to think big picture here and try to get an understanding of the early stage challenges that you mentioned. When we think about some of the therapies that have come into effect in recent years, some stuff that has been life-saving, to what extent do these therapies, do these treatments, do these medications, to what extent do they start or begin with research that is funded by, and so, at some certain point, the U.S. government, whether directly or indirectly through grants to colleges and universities?
Yeah, I'm very familiar with the early stage concepts, having worked before with the university and looking at early stage drugs a number of years ago. So At Cadrenal Therapeutics, our lead candidate tecarfarin is phase 3 ready. So we're a late stage company. Let's go back to our conversation just a little bit a while ago. What you're seeing now is if there's a lack of funding at the NIH, at leading universities that work on compounds such as the University of Florida, Stanford, UCLA, you're not going to see the effects of the lack of funding now for a number of years to come. As I said earlier, the drugs that were approved the last 2 years, there were less than 80 drugs that entered the clinic, less than 90 drugs that entered the preclinical research portion of the process out of about 180,000 compounds. So we're not going to see the effects of the early stage research now due to the lack of funding for more than a decade, which is longer than anything else that's out there in the business world. It's a very lengthy, highly regulated, capital intensive. But it was, we all say in the industry, the patients aren't buying the excuses of delays in bureaucracy, in policies, or funding. The patients need these drugs today. And I think the Orphan Drug Act that was passed in 1983 went a long way in incentivizing and protecting companies such as ours to look at therapies that will help less than 200,000 Americans. Now, the big one that we're following now is HR 946, the Orphan Cures Act, which gives protection potentially to an orphan designated drug in 2 or more indications, which is what our drug does, tecarfarin.
Hey, Quang, before you go, and just because, if you in researching and reading in for this story, a lot of the stories that popped up was about some selling that you were doing. When we see insider selling, certainly by a CEO, it catches our attention. And there's certainly, I think you sold about 5,000 shares or so in late August. What do we need to know? Why were you selling?
Well, it's all part of a plan, and that's part of the regulators allowed insiders and founders to share it, and it's been planned for a while, and it's a practice that allows public company insiders to sell according to plan, which it's put in place months ago. I've been working on this drug for a number of years, over 8 years, and so, like I said, we fully disclose it according to the 144 rule.
All right, we're going to leave it on that note. Listen, so appreciate it and your honesty and directness. Quang, thank you so much for being with us. Quang Pham, of course, joining us there, founder, chairman, and CEO of Cadrenal Therapeutics, joining us from Florida.